Agribusiness, brought to you by Kansas Soybean Commission. The Soybean Checkoff, progress powered by Kansas farmers.
Good morning and welcome back to the show. We're in Wichita, Kansas. We're at the Equine Sports Medicine. Did I get that right, Dr. Preston?
Yeah, it's actually Wichita Equine and Sports Medicine.
Okay, and we're doing stem cell work today on a 20-year-old barrel horse,
Yes.
quarter horse. A lot of talk about stem cells nowadays, but really we're putting it in practical practice right now.
Yes, sir. We're moving it out of the lab and out of the research area and actually treating some horses with it that are getting their careers back anyway.
How did this all really start? I mean, stem cells, when you think about it, people think of human stem cells, embryonic stem cells. How did we get to animals first?
Well,
Economics? I mean,
yeah, that certainly has a driving factor in this whole conversation. But, beyond that, adipose stem cells, and now we started out, Dr. Chaplin, from the early 90s has been using stem cells from bone marrow. We've used stem cells from bone marrow for cancer patients in humans. We've used them in horses as well as other areas to take our own adult stem cells, put them back into our body. The difference here is that we're actually harvesting them from fat, so instead of being a harvest of like 1 to 2,000, we're up to like 2.3 to 2.6 million per gram of fat that we're actually pulling out of these horses. So.
Economically, does it make it more feasible to use fat stem cells than it is, say, bone marrow stem cells?
Absolutely. But whenever you go through all the lab process, the first stem cells that we did with bone marrow were like a $4,500 procedure. This procedure is going to be in an $1,800 range today. So it's becoming more economical, but it's also less recovery time, and we're able to do them beside the animal now. So it's all in-house. We process all the stem cells in-house. We put them in the animal. Approximately 5 or 6 hours later, the animal from start to finish is ready to go home, rather than being a trip here to harvest the fat or the bone marrow, send it off, come back a week later, to place the stem cells. So overall, it's a better economic picture.
When you're harvesting out of the fat, it really does it give you more options to use those stem cells than maybe using bone marrow stem cells?
Certainly there's some differentiation that goes on. For instance,
well, sure number, I guess, is probably the question I should have asked. I mean, getting the sure number of stem cells versus the number that you got before.
Yes, and so all of that, the trophic factors, everything is different about it than what we started out with. Certain varieties of stem cells, mesenchymal cells are mesenchymal cells, but there is a potential to develop calcium deposits in a tendon if we placed a bone marrow derived stem cell there. So we're eliminating some of those kind of things by using fat, and we can use this for everything from neuron regeneration to inflammatory diseases such as inflammatory bowel disease, or in people Crohn's or rheumatoid arthritis, those kind of things.
Well, we're going to take a quick break. When we come back, if we could talk about Ace, who's going to be our patient today. So we're going to take a quick break. When we come back, we're going to finish up with Preston. You're watching Ag AM in Kansas, and we'll see you in just a minute.
Agribusiness, brought to you by Tarwater Farm and Home. Come on by, we'll treat you like family.
Welcome back to the show, Preston. Thank you for staying with us.
You bet.
Okay, we're going to work on Ace today.
Yes.
We had a chance to go back and see Ace. He's not nervous about the procedure or anything this morning, so he seems to be pretty good.
Not getting stage fright.
He's not getting stage fright. Light sedation.
Yes.
Couple incisions in the buttocks area.
Actually,
or
a needle puncture wound.
Okay.
That needle is a 14 gauge needle that we actually make the incision with, if we were going to call it an incision, versus doing a surgical prep when making an 8 or a 10 inch long incision, which is the other adipose technique that we had used in the past. So now a daub of super glue after it's over with fixes everything, because we're doing a liposarcoma liposuction technique versus actually doing a fat harvest.
And that's something you said when we were talking off camera earlier this morning. You were saying it's just kind of like a liposuction in humans. And
identical.
Exactly, and that it gives you a chance to really not have to put that horse under heavy sedation, light sedation, quicker recovery time.
Standing procedure, less risk of infection, all of those things there are pluses in my mind.
Now we've got a tendon injury on ACE.
Yes.
You'll inject the stem cells after they've been separated from the fat cells.
Yes.
It's directly into that. And you said you got about an 85% chance of success.
The literature quotes an 85% on most literature articles that you'll pick up as far as tendon injuries are concerned. Now, this particular scenario that we're dealing with, I think we're going to have a better success rate because this product that we're now using is new. It's only been around less than a year as far as within the equine population, the type of technique that we're doing. So with that, we're actually mixing it with PRP, some of those kind of things that increase the trophic factors, which also increase the chance that we're going to get 100% success rate.
Ace is a barrel horse.
Yes, he is.
So having good hooves and tendons is extremely important to him. He is 20 years old.
Yes.
But I heard you saying earlier, I mean, as strong as that horse is, he could have an additional 10 years coming out of this injury.
Absolutely. And, obviously, if you were 30 years old on this particular horse, he probably isn't going to run at the same level.
Right.
But I think in his active competition state that he's at right now, if we get the kind of recovery that we've had in the past on the horses that we've started out with, I think we can keep him there at the same performance level for about 5 years probably.
What are some of the drawbacks? I mean, someone's watching the show this morning. We got about a minute left together. Someone's watching the show this morning. I mean, are there any drawbacks to this?
The chance that you get nothing.
Right. And you said that earlier, and we were kind of talking, and I heard you say that. It took me a second for me to kind of register, but I mean, worst comes to worst. I mean,
you don't get any response out of it. But you're taking your own body cells, you're putting them right back in your own body. So the worst that can happen is nothing.
Right. Information to get a hold of you? I mean, if someone's got a horse that would like to at least talk to you about
we have
procedures?
Have a website. That's we-sm.com. But my phone number here in Wichita is 316-733-2020 or 2020.
Perfect. Doc, it's nice to meet you, buddy.
Nice to meet you.
Thank you very
Thanks.
much.